Hi, Dr. Byrd. Good afternoon. I'm Esha, a high school student who's interested in being a veterinarian. I'm excited to introduce our speaker today, Dr. Maria Juarez Byrd, an exotic and small animal veterinarian with a passion for husbandry and owner education. She graduated from Cornell College of Veterinary Medicine with an emphasis in zoo and wildlife medicine. Her current roles include being a wife and mom, telemedicine, relief work, and teaching in the University of Illinois GAP program, which aims to prepare pre-vet students for vet school. I'm thrilled to welcome Dr. Byrd to the interview series on the careers of veterinarians. Thank you so much for chatting with me today.
Thank you for having me.
So first, could you tell us about your type of work or all the types of work that you do?
Yeah. So it's a lot. And I'll go through each of the different sorts of jobs that I have. But the big thing that I tried to do when I was actually entering the workforce after veterinary school was figure out what it was that I needed to be happy and meet my goals. And so my dream job had lots of things in it. I wanted to be able to spend time with my family. I missed a lot of family activities throughout high school and college because I was studying for exams. I missed birthday parties, I missed weddings and things like that. And so it was really important to me that once I got out of school, that I actually had the time to invest in my family. This is my daughter. She was brand new as I was entering the veterinary field. And I knew that I wanted to be her primary caregiver. I just for our family, wasn't really interested in having a nanny or sending her to daycare. I wanted to be the person who was doing all the hands-on stuff with her. I also accrued a lot of debt by going to school for 8 years. And so my financial goals included being able to pay off my own loans in 10 years. And I wanted that to primarily be my income, not necessarily my husband's. I also really wanted to treat exotic pets, or I do want to treat exotic pets, and I want that to include surgery, wellness, and lab work. I did a lot of research in college, which I'll talk a little bit about later on. But I wanted to be able to continue to peruse the literature and use that to improve my clinical skills and my patient outcomes. I was also really passionate about education and mentorship. So I was a mentor all through undergrad and throughout veterinary school. And I wanted to make sure I was continuing to give back to the newer generations of veterinarians and scientists as they come through. And it was really important to me to make that a clear point in my career. And I just wanted to make an impact. And I mean that at a lot of different levels. I want to make an impact at the individual level to help individual animals. I want to do it at a local level to make my community better and healthier. A national level would be pretty cool. It's kind of like a far out there goal. And then an international level at the end of my career would be ideal. Like one of my bucket list items is that I've contributed something to veterinary medicine that just made medicine better across the world. And so those were some of the big things that I wanted to do. And I've done that in a couple of different ways. So I work anywhere from 30 to 50 hours a week. And I'm also doing 80% of the childcare for my daughter, while my husband's at work during the day, and then I work kind of odd hours around that. So one of the things that I do is exotic animal husbandry reviews, where husbandry is like the science of animal care, everything from their lighting to the substrate that they're on. So I do husbandry reviews for zoos, professional associations, and owners. I also do a lot of teleconsultations or telemed online. That's through two different companies. One of them is Exotic Health and Husbandry, which is my own that I made. And then a second one is Vetster, which is much more established than my own. I do small animal and exotic animal veterinarian work, which means typically going in part-time or on a relief basis. And that'll include everything from wellness stuff to urgent care and surgery. And then I'm also an instructor. So I work for the University of Illinois, and part of that is to help students who are in the GAP program who are looking to apply to veterinary school but haven't gotten in yet, but have also finished their undergraduate degree. And I help a lot of those students with their veterinary school applications. So looking at the subjective portion and objective portion of their applications and helping them kind of create this cohesive story of who they are and what they value. So this is my baby. This is my brainchild, Exotic Health and Husbandry. My website is ehusbandry.com. And I essentially work as an independent researcher to identify the husbandry needs of exotic species. And so this includes photos of some of the species that I've worked with and helped with, hamsters, chickens, Eclectus parrots, which we're covering right now with our images, if people can see that. I did a lot of work with crocodilian species at the St. Louis Zoo, and so I've worked with caimans and other sorts of like freshwater reptiles, saltwater reptiles, to help owners kind of figure out how we keep the water clean and at an appropriate flow rate with like the foods that they're feeding them and everything to keep them healthy. Lots of giant tortoises. So I worked with Aldabra, Galapagos, and sulcatas. And then, of course, like your rabbits and some of your other more common small animal exotic species. I also have recently gotten into insect husbandry and care. And so I really love bees. And I'm really passionate about improving the care and enrichment for invertebrates, because a lot of times we don't think of them as having pain or getting sick, but they can. And so thinking about how we can keep them in a healthy environment and just promoting their well-being overall. And then I love fish. I don't get to see a ton of fish, but I absolutely adore working with koi and goldfish. They're amazing. And then this sort of work, the exotic health and husbandry, allows me to work with my family and do a lot of my daughter's childcare, because I can read or listen to a lecture as I'm doing my research while I'm changing her diaper or chasing her around. I can have my 30-minute consultations to educate owners on how they can improve their exotic animal husbandry. And I'm making an impact at the local level that I want to. I can also make an impact at a national level or an international level with this, because some of the exotic animal associations have reached out to ask me to do husbandry reviews for some of the species that they work with. And so just starting to inch into making the larger impact that I hope to. So this is probably like 5 to 10% of my overall work in time. Virtual consultations make up closer to like 30% of my work. There's a lot of misinformation on what a virtual consultation entails. It does not replace an in-person veterinary exam. It's essentially, if you've ever worked in a veterinary clinic and you've taken an emergency phone call, this is what that is, except for you include a video, and so you can get more information about the animal. You are not allowed to diagnose a problem. So if I see a dog that's peeing blood or something like that, I can't say you have a urinary tract infection. But I can say, hey, you know, this could be common in like a 2-year-old boxer. It's generally not life-threatening. Make it to the vet in the next 7 days, which is different than trying to make it to the vet in the next hour, which is what some of the teleconsultations entail. One of the really cool cases that I've gotten to work with it, so I listed 3, but one of my favorites is I have a guinea pig patient with congestive heart failure. He was born with a disorder of his heart where his heart just doesn't pump blood the way that it's supposed to. And his mom is very dedicated to his care. They've built up a whole oxygen cage for him. His mom's an engineer. She built an oxygen cage for him at home. And she likes having weekly meetings where a veterinarian talks to her for 30 to 45 minutes about monitoring how comfortable he is, whether or not we need to add any additional like interventions to keep him good, and talk about grief and the process of losing a pet, especially a pocket pet that most people don't tend to care a lot about, and just get validation there that the efforts that she's putting into this pig and the hurt that she feels as she helps him through his dying process is valid. And so I spend a lot of time consoling her and letting her know that she's doing everything that she can to keep him comfortable. And so she and I meet once a week just to check in and make sure she's doing okay and make sure her pig's doing okay. And this takes a lot of pressure off the local exotic specialist that she would otherwise be talking to 30 minutes a week about her guinea pig care. I also had a call from another veterinarian, a general practitioner who does not work with reptiles. She was seeing a very sick bearded dragon. She knew the bearded dragon was sick, but she didn't know what to do with it. And so I helped her identify what tests might be worthwhile given the history of the bearded dragon and given how it looked on the video, and helped her perform a blood draw where I directed her on how to hold the needle and what size needle and everything to use in order to get enough blood for it. And also helped her calculate what would be a safe blood volume to draw on a sick bearded dragon. And that was something that I was able to do, through the video camera. And then I also had a referral from a local from a local emergency hospital that will help stabilize exotics, but doesn't have a ton of expertise in exotics. And so they had a couple of sick rabbits come in, all from the same owner. that were unstable. The ER stabilized them, but weren't sure how to work up rabbit differentials. And so their nurses contacted me so that I could talk to their owners about differentials and what sorts of tests we might do to figure out why those rabbits got that sick. So the ER helped like upload blood work and x-rays and things like that for me to look at. I helped the owner identify a couple tests. And then that one was really cool because those rabbits were actually only 20 minutes away from one of the places that I do relief work. And so I was able to go into the clinic after we had this video conference and actually do those diagnostics myself. These rabbits had, their faces were too small for all of their teeth. So all of their teeth are crooked. And they needed some dentals to burr down some of the sharp points that were cutting into their mouth. So I was actually able to do all of that for them because we started off with this video call. And it's incredibly flexible. I get to spend a lot of time with my family. It pays well, so I can meet my financial goals while I'm doing it. And I get to educate owners and make the local impact that I want to. I also get to be a relief veterinarian, and so I do that at several different hospitals. This includes the wellness care that you typically see, so just palpating the animal, looking them over, reviewing the history, making sure they're safe and doing well, giving their vaccines, right, and like checking out their fecals, making sure there aren't any obvious health problems going on. I've got to do a lot of surgery, so that's me there with the ducky cap in the bottom and the red mask, and I'm doing surgery on a guinea pig bladder. The green arrow there at the bottom is pointing to that itty bitty pink bladder there, but he had a very large bladder stone and it was painful and causing him issues, and so I went to surgery to do that cystotomy and remove that stone for him. I've done a lot of dentals, the way that I kind of described with the rabbits, and I do a bunch of urgent care stuff because I typically work evenings, usually from like 5 to 8 or 5 to 10 p.m. So some of the urgent care cases that I've seen include the hamster at the bottom. This is a hamster that was eventually diagnosed with iatrogenic Cushing's disease, which means we caused his body to have or produce too much of a cortisol hormone. And that's because he had allergies, and his owner thought that giving him human grade Flonase 5 times a day for 5 months would help control his allergies. It ended up being a ton of steroids for this teeny tiny hamster. And he ended up developing a disease from it. But it was very cool. He essentially was getting really slow. He got really fat. He was losing all of his hair. One of the differentials for this sort of hair loss is a cancer, which is really common in hamsters. And so we were able to pull away the steroids, and within like 1 to 2 months, all of his hair grew back. So that was really cool. And then the top photo is a dog that I saw in emergency. He was bit by a snake and he started bleeding out kind of all over his body, which is where you see this big purple bruise. And so he was actively dying when I saw him. We were able to stabilize him. And that picture where his skin looks more normal or peach on the side is about a week later when he's responded to all of our therapy. So those are some of the things that I get to do while I'm actually doing my relief work. It's very varied and a ton of fun. He actually, that snake bite was a dog that I had seen when I was doing a workcation. So one of the ways that I can meet my financial goals is I look to see if other veterinarians who practice or own a clinic are interested in taking a vacation with their family. And while they are gone, I will go fill in and be that veterinarian. And where I go fill in is based on places that my family wants to go and travel. And so my family had a place that they really wanted to go to entertain the baby and my husband. And so I went to this clinic. I worked there for about 5 hours throughout the day, which paid for our stay. I did that for about 2 weeks. And so we were able to go have a fantastic family time. We had a ton of fun on the weekends. We tried a whole bunch of restaurants. And at the end, I actually ended up making money because I was working during the mornings. And so it was a ton of fun. The clinic was fantastic. You can be a little bit picky about what you want when you're doing these workation things. And it just worked out phenomenally. And we ended up helping a snake bite victim along the way. So that allowed me to do my family time because I can plan all of my relief shifts around what my daughter and what my husband need. It helps me meet my financial goals because I charge what I need to in order to make a living, right? I get to take care of pets, save a couple along the way, educate owners, build really good relationships with them, make sure they're taken care of so that their primary care veterinarian can get the hard-earned break that they deserve, and make an impact at a local level. And then I think this is the last thing that I do. The last thing that I do is I'm an instructor at the University of Illinois. And so this is in two different programs. One of them is the Master of Veterinary Science program, which is aimed for individuals with an ag background who are interested in learning how to better identify some of the health needs in the agricultural animals that they care for. I also do help teach in the Vet Med Graduate Academic Program, or the GAP program at the University of Illinois. And this is an asynchronous program or virtual program for students who are trying to get into vet school but haven't had success yet. And so our goal is to introduce them to the depth and complexity of material that they are going to get in veterinary school, while also helping them develop professionally and build their resumes and their help them kind of construct their essays in a way that's best representing who they are to the admissions committee. And so that includes some of like the anatomy stuff, pathophysiology, and how the body takes care of itself, or homeostasis. And that allows me to do a lot of things. I get to work with my family because it's virtual. It tends to have opposite hours of my husband, so he's always watching my daughter while I'm doing the virtual stuff. The University of Illinois is incredibly family friendly. The other faculty that I've worked with have just been incredibly patient and open-minded and open-hearted to my daughter running around in the background. Well, I think all of the other members are also parents, and occasionally you'll see their kids running around in the background. And I just think they're doing an incredible job of mentoring both the young teachers coming through as well as the students, in terms of trying to create a better work-life balance for veterinarians in general, and making us a little bit more human to each other. Oh, I'm sorry, I might have gone through that too fast.
That's okay. Thank you so much for discussing all about your work with us. I think it's amazing how you're able to help animals as well as people. It seems like a lot of fun. Could you tell us about your education and training that prepared you for this career, how it helped you, what were maybe some of the prerequisites, where did you study, and maybe if you had any influential mentors?
Absolutely. Oh my goodness. I had so many influential people. I've just been incredibly blessed throughout my entire life, to be surrounded by fantastic adults who really cared about me, and wanted to help me meet my goals. So I guess I'll start off in high school. In high school, I was very confident that I wanted to be a small animal veterinarian. And this is because the practice that I shadowed at in Kansas City, Missouri, it was Blue Springs Animal Hospital. Dr. Gina Bradley allowed me to shadow her once a week for like 2 years. Because I was homeschooled, I was able to go in during the time that other people would be in like public school. So I did a little bit of shadowing / apprenticeship with her. Absolutely fell in love with it. All of the doctors there were so helpful. They let me watch surgeries. They asked me what I thought about things. I still vividly remember like this giant white boxer with this huge mass on its side, and the doctor like slowly, like painstakingly removing it. And then, boxers have like a ton of extra skin. He took all of that extra skin and he sewed it back together, and this boxer looked brand new, and it was just beautiful. And I was like, I want to do that. I want to take that mess and that nasty, like cancerous growth and make it better, and the surgery was just incredible. I was overzealous in high school. I didn't know how AP credits worked. I thought they were just the like the class that you should take if you wanted to take a hard class. I didn't understand how college credits ended up working out. And so I took several AP classes my sophomore, junior, senior year, ended up earning like well over 30 college credit hours, somewhere between like 30 and 47. It was a lot. It was very aggressive. It was super hard. Graduated with a 4.2 GPA in high school. I was also very involved in sports. So I did competitive swimming and taekwondo. In terms of fantastic mentors, my taekwondo team was just incredible. They really believed in instilling the values of respect and hard work and diligence and perseverance in students. And so we had this whole mantra that the principles of black belt that we repeated every single day, before and after practice. And Terry Gautreaux was my taekwondo instructor. She was she is an incredible woman. She's still teaching today. But she was actually an Olympian, and she won a bronze medal in the Olympics. And she is the most humble, incredible person I've ever met. She actually she saw a guy He was drunk. He crashed his car into like a house or something. And she chased him down in her church dress. She like runs marathons. She chased him down in her church dress and she was like, "You need to turn yourself into the police." And she's like this teeny tiny, like 5 foot tall woman, like very petite, but just so strong and so humble and just an incredible inspiration. And so I always wanted to be as like strong, not physically strong as her, because that's not a goal of mine, but like I always just wanted to be as like intellectually, like emotionally strong as her. And so she was just I was so incredibly lucky to have her as a mentor growing up. My mom is a very strong and intelligent person. My grandma is a very strong and intelligent person. And so having them as my mentors, just strong female leads in my life, has been incredible. My dad is an incredibly fun, hardworking man. He is so good at working with people. He has an incredibly infectious personality, and I always wanted to mirror that growing up. So they've been incredible mentors. And then my last point there with high school is just I had a lot of small animal shadowing experience thanks to Dr. Jean Bradley. Um, I went to the University of Missouri for my undergraduate degree in animal science. I did not know how college worked. I thought that an animal science degree meant that I would be working with dogs and cats. And my very first day out in this program, they had us vaccinating chicks and working with pigs and working with cows and horses. And I absolutely fell in love with large animal medicine. And so I ended up doing like a capstone project in how to take care of pigs. I learned a ton about agriculture and how we raise and take care of animals. This was my first introduction to animal husbandry. So how do you feed an animal and raise it for human use while still limiting the stress on the animal itself? And how do we do that in an ethical way? The professors at the University of Missouri are absolutely incredible. They were so kind and so helpful. I mean, they would walk by me just like in like people that I didn't know, professors that I didn't know would walk by me in the halls and just ask me how I was doing, how my classes were. It was a very small, tight-knit community. I can't speak highly enough about the animal science program at the University of Missouri. While I was there, I did research in 2 different areas. I did research in with traumatic brain injury, so neuroscience. And that was a ton of fun. That was my first introduction to lab animal medicine. And I got to work with mice and rats and essentially understand how we compare physiology. How can you look at an animal like a mouse or a rat or a rabbit and learn something about humans? And so learn some of the limitations as well as the possibilities when it comes to comparative medicine. I also studied reproduction, and so I worked with the animal science department to better understand delayed implantation and better understand how like reproduction works in pigs, which was a ton of fun. I ended up with a minor in computational neuroscience, which is essentially the science of taking a biologic problem, like something like infection rate or how a neuron works, and turning that into a math equation so that you can model it inside a computer. And so I took a ton of computer programming classes. And at that point, I thought maybe I'll go into neuroscience. Not I'm very happy that I didn't end up doing that. It's a lot of work. It's very hard. This is built for somebody that's not me. But really, really enjoyed some of the like computer knowledge that I ended up gaining through that minor. I also got a minor in leadership and public service. And both of those minors, the computational neuroscience minor and the leadership and public service minor, were only possible because I had come into college with so many credit hours. Basically, I only needed to take, I think I only and it needed to take like 2 years worth of full-time schooling in order to graduate with my undergraduate degree. I decided to take 3 years and spend that extra time just exploring some of the classes that I liked. Because I had done so well in high school, I got a bunch of scholarships. And because I had scholarships for 3 years, it made sense to take the extra year to figure out kind of what I wanted to do. And so that's why I ended up having space to do a computational neuroscience minor and a leadership and public service minor. Learned a ton, really loved it. I also had the opportunity to do a lot of study abroads. And so I got some scholarships. I was able to go to Costa Rica, where I essentially learned about ecotourism. And how we can maintain land in an area and then use tourists to help pay for that land. And so that's very popular in South Africa and Costa Rica. I learned about wildlife management in South Africa, and then I went to Thailand and I did a ton of scuba diving and learned about bioconservation and biodiversity and trying to maintain that, especially in an aquatic system. So lots of different things there. And then the nice thing was, because I had done so well in high school, the University of Missouri had a pre-veterinary scholar program that I qualified for based on my ACT score and my GPA. And so what that means is I had a seat in their veterinary school, so long as I jumped through the other hoops. And so it took off a lot of the pressure of just being a pre-veterinary student in general, because I knew that so long as I could meet the academic goals that the university set for me, I had a spot in at least one veterinary school. And then my journey kind of on the side, I changed my mind a lot about what I wanted to do. I was very sure that I wanted to be a small animal veterinarian when I was in high school. And then I went to college and I fell in love with large animals, and I thought I was going to work with cows. I shadowed a large animal veterinarian out in Lewisburg, Kansas, and he was amazing. The clients were amazing. It was so much fun. Working cattle with farmers was probably some of the most fun that I have ever had, the most relaxed experience. It was just, and they were so eager to like teach me and like invite me into their world. It was amazing. In vet school, I did more research and I was like, well, maybe I want to do live animal medicine. And now I ended up with exotics. And the reason I ended up in exotics is entirely because I met my husband. So my husband's last name is Byrd. My maiden name is Maria Juarez, or Maria Juarez. I met a guy, his last name was Byrd. I knew I wanted to be a veterinarian, and I was like, I can't be Dr. Byrd and not be a bird vet. And so I ended up shadowing at a wildlife hospital, and I just fell in love. They're amazing. It's so much fun. I took a ton of extra classes in exotics while I was going through veterinary school. And they're just incredibly fascinating. And so no regrets, no regrets. I did a ton of exotic stuff in veterinary school. So the man behind me, this is at the white coat ceremony that you go through right before you enter clinics. And so I've now finished all of my like didactic learning, where you're in the classroom and they're about to send me off to go actually work with patients and clients in the clinics so that I can go learn from the expert clinicians. The man behind me is Dr. Charlie. He is incredible. He was my mentor. He studies reproductive physiology, and he's the head of the Therio department, the study of repro medicine at Cornell. And he allowed me to do some research with him. He helped set me up with an internship at the St. Louis Zoo, or the Association of Zoo and Aquariums Reproductive Management Center, where I spent 13 weeks working with all of the animals that you see there on the side. So penguins, alligators, sun bitterns, Mexican wolves, and lots of other things in between. And essentially my job was to try and figure out why those animals weren't meeting their reproductive goals, and review their husbandry and try to identify whether or not there were any ways that we could intervene or any tests that we could do to help those animals out. And so that was a way for me to get some really fantastic zoo experience, and just work with absolutely amazing species. I also did a lot of volunteering at the Wildlife Health Center there at Mizzou, or there at Cornell. And then I spent, I think it was 16 weeks, it might have been less than that. But the University of Missouri is incredible in their lab animal medicine programs. And so I went back to Mizzou for an internship to study comparative medicine, and essentially figure out how different sorts of how you take care of lab animals and fish and finches and a whole bunch of other things that live inside that we use for research. And the lab animal medicine, the lab animal veterinarian's job is to advocate for the welfare of the species that are being tested on. And so lots of ethical work that I was able to dig into in philosophy, and it was just incredible. And then I had a couple of other kind of zoo wildlife rotations, which were just a ton of fun.
Wow, thank you for sharing that. That was an amazing career path.
It was a ton of fun.
Yeah, it looks like it. Could you share about like what the most rewarding aspect of your career is?
There are lots of things that I like. I really like when a sick animal has come to me and they may have otherwise died without me intervening. Having the knowledge to help them has been incredibly rewarding. So that dog with the snake bite, he would have died if I didn't know what to do and I wasn't there. And it was incredibly rewarding to have the knowledge needed to help him in that time. One of the more surprising and rewarding components of my career has been helping humans. when their animals have untreatable diseases, when care would be futile, and just helping them through the grieving process and letting them know that they've done everything that they can and that it's okay if they don't spend $10,000 trying to fix their gerbil with cancer, right? Or trying to fix their service dog with cancer. Helping the humans through that and giving them the knowledge that they need to feel comfortable with the decisions that they're making it's incredibly rewarding. It feels so good to help bring them to a good place.
That's very inspirational. You definitely have made a very um good, like a very important impact on so many animals and so many people.
I
Um,
appreciate you. It's been a ton of fun.
so do you think the profession has changed in recent years? And how are you and other successful professionals adapting to this?
Yeah, so probably the biggest change has been the growth of technology. So there are lots of things that are hitting our field right now. The number of pets has increased. The relative number of veterinarians is the same or going down because we have a lot of them retiring. The percentage of veterinarians who are female has gone up. And that means the percentage of people who are pregnant has gone up as well. And pregnancy does influence, it is influenced by workplace safety, hours, things like that. It can be incredibly challenging to be 9 months pregnant and trying to do surgery for 3 to 4 hours, or to wake up at 2 a.m. because you were up all day and nauseous and whatnot. And so those dynamics have changed. The quality of care that people want for their pets has changed. And so, 5 to 10 years ago, or maybe longer than that, maybe 30 years ago, people may not have thought about whether or not their cats need their teeth cleaned and whether or not their cats were comfortable. 30 years ago, people may not have cared why their old dog was losing weight. And now we're at a point in medicine where we can offer really high quality chemotherapy. We can offer specialty MRIs and CTs, do brain surgery on dogs. We can do spinal surgery on animals. There are new techniques being developed for the type of surgery that can be done in like turtles and wildlife and things like that. The quality of care that people want for their fish, for their pocket pets has increased. And so the number of veterinarians has either gone down or stayed the same, or at least the number of veterinary hours. And the quality of care that people want for their pets has gone up. And so the demand for high quality veterinary care has gone up. And that's been incredibly challenging emotionally and just like time-wise, like strategically for both veterinarians and owners and pets in terms of trying to get everything to sort out that way. So I think the biggest growth that we've had is the demand for virtual medicine, or teleconsultations, which is something that I've obviously jumped into, but a lot of other moms, a lot of other veterinarians are jumping into as well, because it offers so much flexibility. The other thing that we're seeing is very fewer and fewer veterinarians who are doing on-call. Used to not be crazy for you to just have your phone on you 24/7 for any emergency, maybe because you were the only veterinarian in the area, or because your clients depended so highly on you to be the one to care for their pets when they were sick. But that's really hard to do for large cities. I mean, it's hard to do for anyone. You have a couple hundred patients, like they could get sick any day of the week, anytime, right? It's hard to be available 24/7, 365. And fewer veterinarians are willing to do that because they desire to have a life outside of medicine. And so those things are all impacting veterinary care. I think veterinarians in general are getting better at prioritizing their family needs, and their self-care needs, especially with the high rate of suicide in our profession. I think people are realizing that it's important. And so all of those things are impacting that. And the thing that virtual care does that simply being on call doesn't allow you to do is turn off the computer, set your hours so that clients, if they're going to contact you, are contacting you during a set period of time that you are comfortable being contacted, and opening up the door for veterinarians in other states to potentially help triage some of those issues, and some of those questions so that we spread out some of that demand and that pressure. And so I think it'll be interesting to see what becomes allowed in virtual medicine, whether or not we're allowed to do the same thing that pediatricians are allowed to do virtually, or whether or not we see more restrictions because people are afraid of what what steps in terms of like medication and diagnosis and prognosis and things people are going to try to take without having a true veterinary patient-client relationship. So I think we'll see a growth in virtual care. I've really loved it. I think it's been fantastic for my work-life balance. I went to hating being on call to really loving working through Vetster and being available a lot more hours than I used to be. So we'll see how all of that changes over the next 5 to 10 years. I imagine there's going to be a lot of growth and complexity when it comes to how we use the internet and technology in veterinary medicine.
Yeah, 100%. I think that's a very interesting point. I'm excited to see how the profession will look in the future.
Yeah, I think it's going to be a big growth, but I hope that I think in general we're an adaptable profession. I think we're going to do well with it.
Yeah. For young people like me looking to go into veterinary medicine, what are some things that we need to consider before going to vet school and when choosing a pre-vet or vet school to apply to?
So there are lots of things to consider. One, did you actually hit the prerequisites that the veterinary school wants? I am a huge proponent of looking into vet schools and vet school requirements early. And I mean, like, if you think that you want to go to a vet school your senior year of college, like you're pretty confident that you want to be a veterinarian, your senior year of college, you should start at least looking to see who has veterinary programs and what classes they might demand. Now, you do not need to be an animal science major. You don't need to major in anything animal related in order to get into vet school, but you do need to at least have the prerequisites in order to go. So if they are requiring an anatomy class with a lab and your school doesn't offer an anatomy class with a lab, then you cannot apply to that veterinary school until you take that course. So the earlier in your program, you know what courses you need to take in order to at least apply to that program, the easier your undergraduate experience is going to be. And the reason is because if you're strategic about the classes that you're taking, you can spread out some of the harder ones. So instead of taking, physics 2 and organic chemistry 2 and biochemistry all in the last semester right before you apply to veterinary school, you can spread those out a little bit with like leadership classes. Or if you're interested in like underwater basket weaving or like a PE or a running class, or you want to take a leadership class, or like there was like a flower arrangement course that I could have taken. I was really interested in it. It just didn't work out with my schedule. But spread out the classes that you're going to enjoy with the really tough classes to pad your GPA. That way you're not walloped with a super hard semester your third year of veterinary or your third year of undergraduate, because that lower GPA is going to negatively affect your application. I think that's the big thing in terms of preparation. Culture matters. The culture in New York was incredibly different than the culture at the University of Missouri. Both provided incredible resources, incredible educations. I do not regret my career path at all, or the schools that I chose. But test the school out. Make sure that you actually like the culture before you go. That I think is really big, and you can do that like your junior year, your senior year of college. You don't have to do that right away. But go ahead and shop around. I also highly recommend applying to more than one veterinary school. I generally recommend that my students make a list of 15 top veterinary schools that they like and figure out why they like them and rank them. It could be because of finances, but it could also be because of programs. Some schools offer way more exotics experience and way more exotics courses than other schools do. Some don't touch on beef cattle at all. Some don't even have pigs that you can work with. And so depending on what sort of work you want to do in the future, you certainly don't have to pick it early. A lot of us change our feelings kind of down the road. But if you're dead set on being a pig veterinarian, then you might want a school that actually has pigs available.
Yeah, that was super great advice. That was very helpful. Thank you. How should a vet student go about deciding career paths after vet school? And do you think vet schools prepare vet students for this?
That's hard to say. I think that the way that veterinary schools prepare students for veterinary medicine is they teach them how to learn or find the information that they need to know. So you will never know, you're not going to graduate veterinary school and know how to treat every disease that walks through the door. There will be a lot of diseases your first couple months out of veterinary school where you're doing research to figure out what is the body system involved, what medications are available for you to treat them with. You're going to ask lots of questions several years after you graduate from veterinary school. So you don't need to know everything once you graduate. So I think that's the primary responsibility of the veterinary school, is to teach you how to be an adaptable learner and a lifelong learner, because you're going to need that to be a successful veterinarian. I think that you should not feel a ton of pressure to figure out what you want to do early on. Because there are plenty of zoo veterinarians who went to schools that don't offer any sort of exotics experience. There are plenty of large animal veterinarians who work with beef cattle who went to schools that mostly focused on dairy. And so your job is to learn to be an adaptable learner, not necessarily to learn everything you need in order to be an expert by the time you graduate from veterinary school. I think you should do what it is you're passionate about. If you really like jewelry or makeup, study that. If you really like rabbits, spend a lot of time with them. If you love art, there's a space in veterinary medicine for artistic veterinarians. And so I highly recommend that you figure out who you are outside of veterinary medicine. One, because it's going to protect you from depression and suicide rates. The other is because we all need work-life balance. And when you apply to veterinary school, they're really not looking to see how passionate you are about veterinary medicine. That's not what they're looking about in your essay. They're looking to see what it is you value and what it is you're going to bring to the table when you apply and when you come into the class. And so knowing what that is before you actually apply is huge for you, right? So do you care about family? Do you care about individuals with special needs? Are there low income communities that you're really passionate about helping out? And most people are really confused about that when it comes to applying to veterinary school. I'd say in the weaker essays that I read, most of the weaker essays focus on a cool experience that a veterinarian, like a cool thing that a veterinarian did that they were awe-inspired by, and then they decided that like they wanted to be that same hero, when really everybody who's applying to veterinary school wants to be that animal hero, you know? And so what sets you apart from the rest of the class, what's going to help protect your mental health long-term, what's going to help protect your family or help you meet your personal goals long-term, is to figure out who you are and what you like outside of medicine. And so I know that that school is competitive. I definitely lived a competitive life. But it's okay to be a person outside of that too. And I highly encourage everyone to try and figure out who they are outside of veterinary medicine. And that I hope answers your question.
Yes, thanks for sharing that. That was very thoughtful and very great advice. What are some of the common mistakes that you see early career veterinarians make?
As an early career veterinarian, I think the fear that you're supposed to know everything is big. Not asking questions right away and being aware of what it is that you don't know. I see a lot of my peers, I feel it myself, being afraid that we're not. So when you're going through high school and when you're going through college, to get the A in the course, like you do a perfect job on the test, right? Like you study what you need to know and then you regurgitate that and you get the A, and like fantastic, you did perfect. Well, there's not a ton of grading in veterinary medicine, right? Like once you go into the real world, there's no A's or B's, and you're working with lots of grayness in terms of what finances people have, what we know about the species, what you can physically do based on like your own skill sets and like what you're familiar with, whether or not your hospital actually has the machines to run the lab work to figure out what's going on with the weird skink that's sick. All of those things influence it. And you move from this area where perfection was attainable and perfection was required in order to get into veterinary school, and perfection was celebrated as you're going through veterinary school, and you finally graduate and it's no longer attainable. And I think a lot of people feel a lot of guilt for not being perfect anymore. A lot of veterinarians feel like failures because we didn't figure out the right answer, or we didn't figure out the right answer right away, or we didn't figure it out quick enough, or we spent an extra $300 from the owner because we weren't sure whether or not our gut instinct was right, and then it was, and then maybe we wasted the money on the test. And I think just being comfortable with the fact that nobody knows everything. Um, Medicine is an art. There is no perfection in it, and we try to do our due diligence and make things the good to the best that we can. But a lot of those things actually fall outside our capacity to make things perfect. And so just recognizing that it's okay to be imperfect. It's okay to not have the right answers, and nobody expects, well, maybe like an owner might expect you to know everything, but there's no realistic way for you as a veterinarian to know every possible medical interaction, every possible test, every possible disease in every other species besides humans. It's an impossible goal. And so hopefully like dropping that pressure to be perfect is something that we can all do as we progress through our careers, but it's something that we've all kind of struggled with.
Yeah, that's very inspirational. That was very thoughtful. Thank you for sharing that. And lastly, what are some of the challenges commonly faced by veterinarians?
I think it's something that's called like champagne taste on a beer budget, where either the owner or the veterinarian would like to provide platinum level care for a pet, and we simply do not have the capacity to do that. So when you're going through veterinary school, you're going to be working in a state-of-the-art facility with some of the greatest intellectual leaders of our profession who are passionate about teaching and passionate about their types of medicine that they're performing. And they're some of the best in the world at it. And so you get to learn from all of these incredible people. And then unless you're doing like an internship at a university and you're continuing to work with clients who have a lot of financial resources, you're probably going to be working with a lot of clients who are financially limited, who don't have, the several hundreds of $1,000s to figure out exactly what's wrong with their pet. And you're going to have diseases that may or may not be treatable based on that. And so working within the limitations that you have is incredibly challenging. And also explaining that to the owners, because you never want anybody to feel guilty because they don't have a couple $100s to spend on their pet. That is something that my family did not have when I was growing up. That's something that I would never judge or fault anyone for. But it really stinks when you have something like a parvo puppy who could have been saved with, a $20, $40 vaccine, who now has, who needs $2,000 to survive that nasty virus. And so that desire both from the veterinarian and the owner to do the best of the best for the pet, and then just not have the money to be able to run the ultrasound machine or to take the x-rays or to take the dog to surgery hurts a lot. And it hurts everyone involved. It hurts the pet, it hurts the owner, it hurts the vet. So that's probably one of the greatest challenges that we face.
Yeah, that is a very hard part of the career. Dr. Byrd, thank you so much for chatting with me today and sharing your experience and insights as a veterinarian. It's so inspiring to hear you talk about your career journey helping so many animal species and clients as well. I wish you continued success in your career.
I appreciate it. Thank you so much for having me.
Okay.